I think when we heard from the parents of Cauchi earlier this week, it was heartbreak all round. You could see that they were devastated that their son had
Yeah.
committed such an atrocity. And I'm prompted to talk to you today because I was contacted by a lady named Kay, and she took the time to lay out her personal experience. Her only daughter had serious mental health issues from a very young age, and she wanted me to understand what it was like to have a child in that situation. And I relayed these details to you as well. I wonder if we could speak directly to Kay this morning and other people in her situation.
Okay, absolutely, Laura. Well, as you know, schizophrenia and the treatment of schizophrenia has been a big part of my career. I've been president of the International Schizophrenia Research Society. I've looked after countless people with psychosis and schizophrenia, and we've actually improved the outcomes for those illnesses by intervening early and helping them to make a much better recovery with holistic care. And that, to some extent, did happen with Joel Cauchi. He did pretty well after being treated initially for many years, actually, when he was receiving effective treatment. And these illnesses can be effectively treated in most cases. But the problem was, because our mental health system is so threadbare across the country, and you and I have talked about this many times, what's happened to Joel is almost the norm for seriously mentally ill people, or certainly way too many of them. If they improve and they get a bit better, they're discharged from the vital services that they need, which are in incredibly short supply through state governments since the closure of the mental hospitals. They haven't done their job in providing a safe and environment for the states that they operate in. The community mental health system is very modest and is overwhelmed with demand. So there are hundreds of Joel Cauchis wandering around Sydney and Brisbane and Melbourne as we speak, off medication, disengaged from their families and disengaged from the effective care that would keep them well and would keep the community safe. Now, it's a rare event because most people with schizophrenia are not violent and never will be. And the ones that do things like Joel did, he was a very good person when he was well. You could hit all the evidence about him when he was treated and well was there was nothing wrong with his character or his personality. It's the illness that has caused these events. The fact that the illness was allowed to flare up, remain untreated, and completely take over his mind. So he did things that were unspeakable. And that is a risk with a very small number of people with schizophrenia. Most people with schizophrenia, well, are safer than the general population. They're more likely to be victims of crime than actually to commit any criminal offences. The ones that are allowed to deteriorate to this stage really stigmatise everyone with schizophrenia. So everyone with schizophrenia in Australia today would be feeling very hurt as well because their identity and image as a person has been harmed by these acts, which were preventable if we had functioning mental health systems in New South Wales and all of the states. The federal government's got a massive role to play here too, because there's a very big gap which exists between the boundaries of the state services and what GPs and the primary care sector provides. We call this the missing middle, as you know. So Joel fell into the missing middle, even though he was in the very severe end of need for care.
Pat, we'll have to leave it there for today. I know it's a longer conversation, but thanks for making some kind of sense of it for us today, and also that advice and how we can support our family and friends. Appreciate it.
Yeah, thank you, Laura, for your great support of mental health as always.